comes out, and the trunk quite strong. Goes for one big massive wow, Eureka type movement. Okay, take that back.
Shih Tzu mix, who the owners went to bed at about 1 a.m. Not last night, but the night before. When they woke up at 9 a.m., they found him in the hallway. He had urinated and defecated on himself and vomited, and appeared very off balance and unable to get up. So they took him to their primary, where he got some Serenia and some diazepam. They monitored him for the day. Didn't see any improvement, so they called us last night. So on his exam, so he has kind of an intermittent menace response in his left eye, normal in his right eye. When we have him supported and check his proprioception, so his awareness of where his feet are, it's normal on the left side of his body, but absent on the right side of his body. Took a look at Butterball, putting our exam findings together. We have the left-sided head tilt, the intermittent menace in the left, or absent menace in the left side, the vertical nystagmus, the strabismus in the left side, the proprioceptive deficits on the right side, kind of his desire to go to the right or fall to the right. All of those point to a problem within our balance system, particularly within the central vestibular balance syndrome, or centers of his brain. And he's demonstrating what we call a paradoxical vestibular syndrome, in which the head tilt is actually away from the lesion. And in these cases, there's sort of three very specific localizations for this. So either the follicular nodular lobe of his cerebellum, the caudal cerebellar peduncle, or one of his vestibular nuclei on the right side. So the side that we see the worst proprioceptive deficits, which again, his are normal on the left, absent on the right. And because of that, we see this, what we would call, again, the paradoxical vestibular syndrome. So the head tilt is away from the lesion. Things that we worry about in Butterball specifically. So took a look at his blood pressure. It was elevated, so kind of his age, his breed, all fits with a stroke. And that would be our best case scenario for him, because odds are he's going to improve from that. It's going to take a couple of days, but he should get better. Then the biggest thing with a stroke is then trying to find an underlying reason why. So about 50% of cases we don't find an underlying reason, and we don't really want to, because then the odds of it happening again are low. But if there is an underlying cause, then we want to discover that so we can properly treat that to reduce his risk of having a secondary stroke. Other possibilities include things like inflammatory disease, so meningitis, infection, so he's got a history of chronic ear infection, so it's possible that he's had an ear infection that is broken through, so he's gone from sort of a peripheral to a central, and it's caused an infectious meningitis, or unfortunately a neoplasia, so a tumor of some type.
Here.
Frank.
He looks great.
Frank Castro.
Yes.
Yeah. Awesome.
He's doing really well, hasn't had a seizure in a year on his current regimen.
Oh, Dr. DiVita says he's doing great. No seizures coming up on a year, or just over a year. We're still on all of our medications. Our phenobarbital levels kind of a little higher than than we like for the average dog, but markedly better than where he was when he was not doing well. And all things considered, we decreased from where he was before. All things considered, we're going to keep everything the same. So, what do you think about that, Frank?
Frank.
Huh?
He's like the laziest. Not only like the Saint Bernards are already lazy, then you put like the medication to it. It's like you just created the most laziest dog in the world.
Okay.
Yeah, there you go.
What do you think, huh?
You are too big to be hiding in the corner.
It's good.
Come here, Frank.
I think we should continue everything as we've been doing. the phenobarbital level, we'll get that repeated at some point. Just send that to us.
Yeah, 100%.
And we'll get those medications in for you.
I'm curious to see, how long he makes it, because he's doing well now, but
Yep.
he'll be 5 here in a few months. But most, I still keep in touch with the breeder where I got him from, and most of them have been living until 11, 12.
Really? Wow.
Really long time for a Saint Bernard.
All right.
But none of them have seizures. None of them. Thank you.
Good seeing you.
Thanks a lot. Great to see you. Hopefully we won't see you
Yeah,
for a year.
we'll exactly. See you in the new year. You're out of here, Frank.
Ooh.
Ooh. What do you think?
I think it is going to be a stroke
Yeah.
of
So-
the rostral cerebellar
Okay.
right artery.
So it looks like a cerebellar infarct. We can see this bright spot in the rostral aspect of the cerebellum. It's kind of well demarcated. On this one here, you can see it's pretty well demarcated. For the amount of hyperintensity, there's just a minimal amount of mass effect. So on the diffusion weighted, it's bright. But on the ADC map, it is dark, suggesting an ischemic infarct. So he should improve. The deal's going to be looking for the underlying cause, which might be related to the hypertension that we've documented here. So.
I have Cammie Rogers, our 7-year-old female spayed dachshund for neck pain. Was cut at 13-1 in July. Recovered from that. Dad feels like she's still a little bit atoxic in the pelvic limbs. But after her dental surgery, or dental procedure of some variety, she started holding her neck low, was painful, hasn't responded to meds. On her exam, she's a relatively normal exam. She's a little bit ataxic in the pelvic limbs. Her neck pain isn't profound, but she doesn't really want to look up. She doesn't want to turn her head to the right. She stops herself mid wet dog shakes.
Dr. DiVita was telling me Cammie's been having some neck pain for the last few weeks. We've been trying medications and it's really not resolving. We're not wanting to jump up on things, we're not wanting to move, and kind of holding our head in funny positions. You've seen some muscle spasms at home. Given her age, her breed, her previous disc problems, this is a slipped disc until proven otherwise.
Right.
There are two main directions that we can go when we have a dog that we suspect a slipped disc. One is trying medications and rest, and usually if that's going to resolve things, it does so in a week, usually 2 at the most. So the other way of approaching it is, as you know, doing MRIs to find out what the cause is, assuming it's a slipped disc, doing surgery. There are 98% chances that we can fix this, assuming it's a slipped disc. Kind of since we've already tried the medication and rest route, and it's been going on 3 weeks now or so, 2.5, 3 weeks, it's something that it's time to do something different, meaning an MRI.
Very attached to Dad.
Big time.
She just had the lumbar surgery here in June.
Yeah, I saw that. Went home on the 4th of July or something like that.
I can get her checked in and
Okay.
carry her back while you do paperwork. And,
That'd be great.
all right, I'll take these.
Set her down so you can grab her. Thank you.
Thanks, Dad.
Jilly Bean's a 4-year-old Maltipoo that we saw a couple weeks ago for neck pain and difficulty walking in all 4 limbs. Was able to stand and support, but was not able to walk, would buckle over in all 4 limbs. She had actually had an MRI previously because she had had repeated bouts of neck pain and difficulty walking since she was about a year old, and the previous MRI showed concern for occipital-atlantal overlapping. When we saw her, she had an atlantoaxial instability, so it's probably what they saw on the original MRI. We did a stabilization procedure. She's doing really well. She's walking well. Still is a little long-strided or floaty in her thoracic limbs and her front limbs, but that's not unexpected.
owners feel that she's always walked that way, and that when she's not on medications, she walks even better. So we're giving it time for the bones to fuse. It's going to take months for that to happen, so we're going to continue with crate rest and the brace, and we're going to see back in 4 weeks. We'll radiograph at that point to check for the implants and see how the bony fusion is progressing.
How's it going?
All right.
Good.
How's it going up there?
A little bit crazy, but good.
So I've got a little hook under the longitudinal ligament and dorsal annulus, and I'm using an 11 blade to just kind of incise through it. So I think this is going to be something that comes out kind of chunk by chunk, as opposed to one big massive wow eureka type movement. Okay, I take that back. Thanks for watching. Hope you enjoyed it. Hope you learned something. Hope you found something of value. If you did, feel free to give us a comment, give us a like, share it with someone that you think might get something out of it.